Hello, this is Geneva Briggs. The topic for this program is, can we enhance memory with supplements? I have no actual or potential conflicts related to this program other than the fact that my memory can be pretty bad at times. Who hasn't wished for better memory or the ability to improve their concentration? Many people do turn to supplements in attempts to improve their memory. Memory loss worries many of us as we get older. Many of our patients worry that they are one of the 10 million baby boomers who will develop Alzheimer's disease. For this program, we're going to start out talking about memory and memory loss. We'll go over what the warning signs of Alzheimer's disease are. We'll then talk about some medications that are known to affect memory that we need to look for. We'll then go over the major supplements that have been used to try to enhance memory and talk about what the evidence is for those supplements. And then we'll conclude the program with a patient case about whether we should recommend a supplement in a particular person. Memory is a complicated process. As you can see by this slide, there are many different types of memory. When we talk about enhancing memory, we really should be specific about a particular area that we're trying to enhance, but unfortunately, studies mostly have examined all different areas of memory. It's also hard to prove that any particular therapy is really beneficial. It is easier to prove a difference in memory when the subject has some significant problems, like dementia. Showing improvements in memory in normal, healthy people is very difficult. Because of this, there is far more evidence supporting the use of natural supplements for treating Alzheimer's disease or other types of dementia than for improving mental function in healthy people. As we go along, I will try to highlight where a particular agent has been studied. Many patients who seek out supplements for memory think they're suffering from some type of memory loss. So we need to define some different types of memory loss. Dementia is a serious loss of global cognitive ability in a previously unimpaired person. Affected areas of cognition may be memory, attention, language, and problem solving. There are many different types of dementia. In the very early stages, these can be difficult to distinguish between and can also be difficult to actually diagnose. Of course, we have vascular or multi-infarct dementia from atherosclerotic disease in the brain, primarily, Alzheimer's disease. We also have dementias that are secondary to head trauma, Parkinson's disease, Lewy bodies, alcohol, etc. Dementia is not reversible. Now, there may be cases where we can slow down its progression, but once someone has dementia, we can't make it go away. There are some reversible causes of memory loss. These include depression, anxiety, sleep deprivation, common problem in a lot of us, stress, B12 deficiency, some medications, and delirium. The last item on this list is the reason many people seek memory supplements, and that is so-called age-related cognitive decline. You also see it called age-associated memory impairment or mild cognitive impairment. For this program, I'm going to use age-related cognitive decline or ARCD. A decline in memory and cognitive function is considered by many authorities to be a normal consequence of aging. While age-related cognitive decline is therefore not considered a disease, authorities differ on whether ARCD is in part related to Alzheimer's disease or other forms of dementia, whether it's a very early form, or whether it is a distinct entity. People with ARCD experience deterioration in memory and learning, attention and concentration, thinking, use of language, and other mental functions. It's that as we get older, we're just not as sharp as we used to be. Now, people sometimes believe they're having memory problems when there's no actual decreases in memory performance, whether it's remembering names, numbers, computer passwords, or why we walked into a room. We've all been frustrated by the occasional limitations of our ability to remember. That doesn't mean we have Alzheimer's disease or even any other kind of chronic memory problem. Just as a aside, that walking into a room and not remembering why you came in there is called dyskinesia. The next slide lists the 10 warning signs of Alzheimer's disease from the Alzheimer's Association. But you can use these to also help identify other dementias because they have very similar findings. People with a suspected dementia should be referred for medical care so they can get a diagnosis, because they may have a reversible problem that we talked about leading to their memory issues. And if you correct that, then they're not going to have their memory issues, but it may also be worsening their dementia. Those reversible causes of memory loss can become irreversible if they're not treated. Managing concomitant diseases is also important. Concomitant diseases such as hypertension, lipids, diabetes, and depression. Managing those appropriately can help slow the decline of some dementias. Depends on what a person has, what's contributing to it, maybe worsening their memory. But if you maximize the treatment of those, you can help slow their decline. The next slide is a partial list of the medications that have been reported to negatively affect memory. Many of these can also lead to confusion, so we should be asking about new medications, or actually even a complete medication list, in people who are seeking memory supplements. As noted on this slide, many of these agents have anticholinergic properties. Anticholinergics are additive with each other. We can look at an anticholinergic burden. The more anticholinergic burden, especially an elderly person has, the higher the likelihood of memory issues. Personally, I have seen at least one case of a woman who was admitted to a nursing home with severe dementia. And once we took her off all the benzodiazepines and anticholinergics she was on, she became lucid and was able to go home and live alone. So it's important to look for these things. Now, it can be hard to attribute memory loss to medications, but look for a temporal pattern, i.e., memory worsened after starting the medication. And if it's a medication that can be stopped, memory should improve once you get rid of it. Sometimes what we attribute to a medication may just be age-related memory decline. Although there are a variety of brain boosters on the market, most are lacking research to support their memory-enhancing claims. The ones I have listed on this slide at least have been studied. We will talk about each of them as we go along. Two groups that publish evidence ratings for various natural supplements are Natural Standard and Natural Database. And you can see there are different evidence ratings on this slide. For each agent we are discussing, I've included one of these evidence ratings if it is available. Not all natural supplements have an evidence rating. A lot of vitamins have been looked at for preventing dementias or age-related cognitive decline. At this point, there is no conclusive evidence that any vitamins can prevent memory loss or development of dementia. First on the list of things studied is vitamin E. Although vitamin E apparently doesn't decrease the risk of developing Alzheimer's disease, it may slow its progression once a person has it. Recent studies have raised concerns about an increased risk of death in unhealthy people who take high doses of vitamin E. So it's best to stick with 400 international units per day or less. A vitamin B12 deficiency, which is most common in older adults and vegetarians, can cause various signs and symptoms, including memory loss. In such cases, B12 supplements can help improve memory. When someone older complains of memory loss, they do need to be checked for B12 deficiency because it is very common. Various combinations of vitamins have been studied. Where benefit has been seen, it mostly is in people with age-related cognitive decline who have high homocysteine levels. Now, homocysteine levels aren't always checked in people. It can be hard to identify which group of patients might benefit the most from this. It probably does no one any harm to recommend a general multivitamin supplement to make sure they're getting adequate folic acid, B6, and B12, which are all necessary for nerve function and brain health. Acetylcholine precursors have been extensively studied because of the role of acetylcholine in memory. They're best studied in Alzheimer's disease because this disease process results in an acetylcholine deficit in the brain. Several of them, as you can see listed here on the slide, have not shown effectiveness in Alzheimer's disease trials. They have a D rating. Some clinical research shows that phosphatidylserine, 100 milligrams 3 times a day, modestly improves behavioral and cognitive function in Alzheimer's disease. Unfortunately, the benefit seems to be very short-lived, only for a few weeks. After 16 weeks of treatment, the progression of the disease can overcome the benefits. In age-related cognitive decline, there is some data to show that phosphatidylserine improves attention, arousal, verbal fluency, and memory. So this is an agent that shows some promise. This agent has been shown to increase acetylcholine, norepinephrine, serotonin, and dopamine levels in animal models and patients with Alzheimer's disease. The dose typically used is 100 milligrams 3 times a day. Adverse effects tend to be relatively minor: GI upset and insomnia. If patients are getting insomnia, try to shift the doses earlier in the day, maybe even drop that evening dose. As for drug interactions, theoretically, combining phosphatidylserine with acetylcholinesterase inhibitors or cholinergic agents might excessively increase acetylcholine levels in the brain and potentially cause cholinergic side effects. The acetylcholinesterase inhibitors are, of course, the things that are prescription products approved for treating Alzheimer's disease, like the brand names Aricept, Cognex, Exelon, Remenil, etc. On laboratory testing, taking this agent can lead to some minor decreases in ALT and uric acid, not significant problems. Phosphatidylserine is found in many brain-boosting combo products, but if somebody's really looking to try this, they should use a single ingredient product. These products have not been tested by consumerlab.com, so I can't give you any information on their quality. Acetyl L-carnitine is structurally related to acetylcholine and might act as an analog of acetylcholine in patients with dementia. Once inside the central nervous system, acetyl L-carnitine promotes acetylcholine release and increases choline acetyltransferase activity. Some studies suggest this agent provides Alzheimer's patients some benefit in memory, behavioral performance, and a delayed progression of deterioration as measured by cognitive testing. But there have been some negative findings as well, so it gets a C rating. The latest thinking is that acetyl L-carnitine is more likely to show benefit in patients with early onset Alzheimer's, that is, age less than 66 years of age, and a fast rate of disease progression. It may be worth trying in that subset of the Alzheimer's population. In age-related cognitive decline and alcohol-related dementia, some studies have shown improvements in some measures of cognitive function and memory, but again, there are also negative trials, so it has a C rating. If a patient wants to try acetyl L-carnitine, suggest that they aim for a dose of 1,500 milligrams to 4,000 milligrams divided into 2 to 3 doses daily. It's important that they use acetyl L-carnitine only Only the acetyl form can cross the blood-brain barrier, and only a small portion of L-carnitine is converted. There are some products with D-L-carnitine or D-carnitine. These deplete L-carnitine and lead to more side effects, such as myasthenia syndrome and muscle wasting. So it's important to look for acetyl L-carnitine only. It's usually well tolerated. In some cases, it can cause nausea, vomiting, and agitation. May need to back off on the dose in those cases. There are also reports of depression, mania, confusion, and aggression in Alzheimer's patients. Again, if you're seeing those, back off on the dose some. On consumerlab.com testing, the products they tested all were approved. None of them had any major problems. They contain what they said they contained. One of the top-selling herbs in the United States, Ginkgo Biloba, has been used for thousands of years in traditional Chinese medicine. It is one of the agents that shows more promise than many of the others for enhancing memory. We do think that the mechanism of action, although it's not completely been worked out yet, is related to many different facets. It appears to interact with GABA receptors in the brain. It has some antiplatelet effects. It also has antioxidant effects. So these probably help protect nerve cells from further injury in the brain, may also stimulate nerve cell activity. It also does seem to lead to some improvement in circulatory capacity. Some research suggests that ginkgo is effective for early stage Alzheimer's disease and multi-infarct dementia. It's one of the few natural supplements that get an A rating for memory. Ginkgo may be actually as effective as the acetylcholinesterase inhibitor drugs, such as donepezil, in early Alzheimer's disease. Ginkgo does not appear to prevent the development of Alzheimer's disease. A large study supported this conclusion. Greater than 3,000 subjects got 240 milligrams per day for 6 years. It was not effective in reducing either the overall incidence rate of dementia or Alzheimer's disease in elderly individuals with normal cognition or those with age-related cognitive decline. In people who already have age-related cognitive decline, there have been some positive studies and negative studies. 6 out of 10 have been positive, shown significant improvement compared to placebo in the positive studies, but the studies have all shown different improvements. None of them are very consistent in showing that ginkgo improves one particular part of memory. So that's where it's hard to rate its efficacy, because all the studies have shown small improvements in different areas of memory. As for memory enhancement in healthy people, we know that 6 years worth of it does not prevent the development of dementia. There have been at least 15 studies looking at people without any memory impairment, giving them ginkgo. Only 2 of 15 studies showed any kind of memory enhancement in normal, healthy people. The bottom line, whether ginkgo actually enhances memory and mental function in healthy seniors or healthy younger people, is unclear. The benefits, if they do exist, are probably slight. It does seem to have a role in people who have multi-infarct dementia and Alzheimer's disease and possibly age-related cognitive decline. Ginkgo is well tolerated. Some people can get GI upset, headaches, dizziness. In the 6-year trial I mentioned earlier, the adverse event profiles for ginkgo and placebo were no different at the end of 6 years of therapy. As noted here, there are some rarely reported adverse effects, allergic skin reactions, bleeding from the antiplatelet effects, and seizures. Can't tell you whether those are particularly dose-related or duration-related. It is important that if a patient taking ginkgo is going to have surgery, a dental procedure, anything where they're going to be cut, they need to let the person know because of the antiplatelet effects. They probably should stop the ginkgo at least 2 weeks before surgery. Ginkgo does have some potential for some significant drug interactions. The one major interaction is with, of course, any antiplatelet agent or anticoagulant agents. Caution should be used in combining these. Whoever's managing their antiplatelet or anticoagulation therapy needs to know about it. The combination can lead to significant potential for bleeding. There are case reports of fatal intracranial hemorrhage in combining ibuprofen and ginkgo. The effects on INR are a little iffy. It may not actually affect INR values in combining with warfarin, but by combining an antiplatelet agent with an anticoagulant, you do increase risk of bleeding. A moderate interaction is with insulin or oral hypoglycemics that stimulate insulin secretion. You may see increased glucose levels because of increased insulin metabolism. We're finding more out about the effects of ginkgo on the various liver enzymes. You see here many of the major drug metabolizing enzymes can be affected by ginkgo. It may inhibit or induce metabolism through those enzyme systems. The problem is it's not well defined yet which medications are significantly affected and which are only minorly effective. It appears to be moderate at this point. Because it's such a wide range of medications, what I can tell you is just look for problems after people start ginkgo. That their blood pressure is not as well controlled, their glucose is not as well controlled, or it's better controlled. That may be an issue too. Ginkgo is available in tablets, capsules, teas, and fortified foods. What has really been studied is standardized leaf extract. Doses of 120 to 240 milligrams a day in 2 to 3 divided doses. A product that's standardized to at least 22% ginkgo flavone glycosides and 6% terpene lactones should be used. Product should also contain less than 5 parts per million of ginkgolic acid. Ginkgolic acid's toxic compound primarily found in the seeds of the ginkgo tree. The seeds should be avoided. It can cause seizures. Ginkgolic acid is found in lesser amounts in the leaves than in the seeds, so that's why it's important to use leaf extract. I typically suggest either 120 milligrams twice a day or 240 milligrams in a single dose. I cannot find a reason why the dose needs to be divided. So if someone gets GI upset, then they could divide it. Unfortunately, ginkgo products are the most adulterated natural supplement out there. On consumerlab.com testing, back in 1999, before it became really hot and popular, 75% of the products passed. Then by 2003, 23% passed. Something was going on. In 2007, 59% passed. The most common adulteration is the addition of extra flavonoids from non-ginkgo sources. So on testing for overall flavonoid and terpenoids content, the product's going to pass. So very specific tests for the actual flavonoids in ginkgo extracts have to be done. The added flavonoids are not true to the material used in clinical trials for memory benefits. The next slide just lists some example products that were passed for content on consumerlab.com, their most recent testing. It is important to avoid the leaf powder products because they tend to have lead contamination. Use leaf extracts which do not have lead contamination. Our next agent to talk about is Huperzine. You also see it pronounced Huperzine, but Huper is the most common way of saying it. This is an alkaloid isolated from Chinese club moss or fir club moss. It acts as a cholinesterase inhibitor, thus it increases acetylcholine in the brain. This is the same mechanism as some of the prescription medications, of course, for Alzheimer's disease. Huperzine A is a drug that stretches the guidelines of the Dietary Supplement Health and the DHA Act. Although derived from a plant, it is a laboratory-manipulated, highly purified drug, unlike herbal products that typically contain hundreds of constituents. All 6 clinical trials of Huperzine that I can find were performed in China and reported in Chinese, so it's a little hard to evaluate those studies. It's rated as possibly effective by Natural Database. At least in some of the studies, it does seem to improve memory, cognitive function, and behavioral function in Alzheimer's disease and multi-infarct dementia. It is promoted for improving memory in healthy individuals, but there is literally no supporting evidence for this claim. The Alzheimer's Association recommends against using Huperzine because of the uncontrolled nature of the supplements. In the studies, 50 to 200 micrograms, that's correct, micrograms, twice a day has been used. Only the L isomer is active, and it's only been studied up to 8 weeks of therapy. Because this is a potent medication, it can lead to cholinergic adverse effects that are listed here. It's important to avoid it in children, pregnant or nursing women, and those with high blood pressure or severe liver or kidney disease. Like other agents that increase acetylcholine in the brain, it should not be combined with cholinesterase inhibitors, other cholinergics. Also, combining with anticholinergics will decrease effectiveness. Because of the drug interaction with cholinergics, which tend to be used during surgery, it should be stopped at least 2 weeks before surgery. Huperzine A is a relatively expensive ingredient, creating an economic incentive for making a product with less than the labeled amount. In fact, tests by ConsumerLab.com in 2005 detected no Huperzine in one product. In their most recent testing, lead contamination was possible in some of the products. I give you just an example of one product that passed testing and one that failed here. Not many products are available with this as a sole ingredient. So beware, it's in many of the brain boosting combinations that are out there, and people may not realize the significance of using a very potent agent in these combinations. There's also a possibility of product confusion. There used to be a Huperzine product called Cerebra, which can be confused with lots of things listed here, but I cannot find that marketed anymore. It is sometimes referred to as selagiline, that can be confused with selegiline. Omega-3 fatty acid supplements have piqued great interest for many different indications. Studies suggest that a high dietary intake of omega-3 fatty acids is strongly linked to a lower risk of age-related cognitive decline and Alzheimer's disease. Unfortunately, studies of prevention have been a little mixed, but one of the better ones recently published was a large study using 60 to 100 milligrams of DHA per day reduced risk of developing Alzheimer's disease by 70% over 4 years. Unfortunately, it was only effective in reducing risk in people who were negative for ApoE4. ApoE4 is apolipoprotein E, which is the gene most associated with increased risk for late onset Alzheimer's disease. So it appears that DHA supplements are only effective in preventing Alzheimer's disease in people who don't have the gene for late onset Alzheimer's disease. Because remember, this gene is only one of the genes that have been identified as increasing risk. DHA supplements may prevent the development of Alzheimer's disease in some people. What if somebody already has cognitive decline? The data are less clear in these indications. It has a C rating for dementia. 2 grams per day of DHA was ineffective in moderate to severe Alzheimer's disease. There have been some other modestly positive studies. In age-related cognitive decline, some studies have shown that DHA supplements and other fish oil supplements may slow cognitive decline. You can see some of the doses used here. We don't know exactly how DHA may prevent cognitive decline or how it may treat it once it's occurred. It does have some non-steroidal like anti-inflammatory effects in lowering arachidonic acid. It does appear to reduce the production of beta amyloid peptide, one of the markers seen in Alzheimer's disease. It increases brain levels of neuroprotective brain-derived neurotrophic factor. Sounds really fancy, doesn't it? It also reduces, of course, the development of cardiovascular disease. Cardiovascular disease is a major risk factor for developing dementia. Atherosclerosis leads to dementia. Dosing has been all over the place. For primary prevention of cardiovascular disease, it's recommended that people get at least 500 milligrams of EPA plus DHA per day. At this point, aim for a minimum of 100 milligrams of DHA per day for prevention of dementia. For treatment, it probably requires a higher dose because you're looking at trying to have more of an effect in the brain. The most commonly studied dose is 900 milligrams per day. Vinpocetine is another agent that might be helpful in increasing cerebral blood flow. It's a synthetic derivative of apovincamine derived from the lesser periwinkle plant. It's thought to be a potent vasodilator that acts directly on vascular smooth muscle. It may also decrease platelet aggregation, and it appears to have cholinergic activity. Good studies on its mechanism of action have not been published yet. It looks promising. There is some evidence that it can modestly improve cognitive function in patients with Alzheimer's disease, but so far the studies have only been 6 months or less. It's really too soon to recommend it in most patients. One small study in 12 healthy females did find modest memory benefits from 40 milligrams a day. 5 to 10 milligrams 3 times a day is the most commonly studied dose. It's important to take this with food because it has lousy bioavailability when taken alone. Relatively well tolerated as far as what is published. There's not a whole lot published about this agent. Drug interactions best to avoid using in combination with anticoagulants and antiplatelets. No product test results are available with this agent. Apoquarin is a calcium-binding protein that was first discovered in 1962 in glowing jellyfish. Turns out these proteins cause the jellyfish to glow when the protein's bound to calcium ions, the same calcium ions in our nervous system. This agent's commonly used in clinical studies as a calcium-binding protein to show how calcium works. Supposedly, calcium-binding protein production diminishes with aging and leaves nerve cells vulnerable to calcium overload, which results in cell damage. What the manufacturer of apoquarin promotes is that this agent protects cells from the damage of calcium overload. Unfortunately, the only studies with this agent are, quote, published on the manufacturer's website. At this point, I can only find it in one product, Prevagen, that's sold over the internet and is available in some pharmacies. Their website does present data from a human study that gave 10 milligrams a day for 90 days. It improved executive function, delayed recall, and verbal learning in 40 to 90-year-olds with self-reported memory difficulty. Problem is, you don't have scientific documentation that they actually did have memory difficulties, and we can't review this trial for real efficacy. At this point, I can find no published information on possible adverse effects or drug interactions. This product's not in Natural Standard Database, Natural Medicine Database, nor has it been tested by ConsumerLab.com. I can tell you, though, it was voted the #1 brain health supplement in 2011 by health food stores. But we have really no data to say that it's effective. It's interesting. The basic science studies with it are fascinating. We just don't know what it does in humans. Bacopa is the next agent to talk about. This gets a C rating for memory. An example of one of the studies that have been done with it used 300 milligrams of an extract once a day for 12 weeks in healthy women and men. Found modest improvement in verbal learning, memory, and information processing. So this is interesting. There's not a lot of data about it. It is typically dosed as 150 to 450 milligrams a day of an alcoholic extract. The only adverse effects I can find are nausea, dry mouth, and fatigue. Now, there is a theoretical risk of some significant drug interactions. It does seem to have an effect on some of the CYP450 drug metabolizing enzymes. There's not a lot of detail out there to see exactly which medications this might affect. The ones that are proposed that I can find are calcium channel blockers, thyroid medications, and phenytoin. You find Bacopa in a lot of combination products aimed as brain boosters. Overall, there are not a lot of data on it. Just a few tips when you recommend memory supplements. If you do, go with about a 12-week adequate trial. The person needs some kind of way to measure success. The simplest thing, list out what problems they're having with their memory, and then after 12 weeks, see if those things are better, right? Obviously, in studies, you can do sophisticated memory testing. That's a lot harder for an individual to do, but patients need some way to determine whether one of these supplements is actually doing something, unless, of course, they're using it for prevention. There are no data on combination products except using ginseng in combination with ginkgo. A couple of studies show memory benefits. Whether they're better than just ginkgo alone, we don't know. I recommend people try single ingredient products. So many of the combination products have a lot of extra junk in them. The next slide shows you 3 examples of some crazy combination products. Think fast. Ooh, gotta be good. Well, look at all the stuff that's in there, and it's really because there's a lot of caffeine. Procera AVH, if you look on their website, it says, as seen on TV. So anytime something's advertised as seen on TV, be suspicious. Focus Factor is another one that has a lot of advertising behind it. Has greater than 40 ingredients in it. You get benefits, you don't know which provided the benefit. If you have an adverse effect, you have no idea what caused it. It's a lot of it's a multivitamin with minerals plus iron and a lot of other stuff in a proprietary blend that you have no idea how much of an individual ingredient is in there. Interestingly, it's one combination product that does not have ginkgo, which is probably the most effective. For people seeking memory supplements, there are lots of other things people can do to enhance or retain memory. One is over our lifetime, we need to maximize management of chronic disease. We'd like to avoid developing chronic diseases that lead to memory problems such as hypertension, hyperlipidemia, diabetes, atherosclerosis, etc. But once those are developed, to maximize management is going to go a long way in preserving our brains. Other healthy lifestyle things that help preserve memory are moderate alcohol intake or less and no smoking. The big one is exercise. Exercise apparently can help enhance memory in a variety of ways. It generates blood flow. It seems to help form nerve cells in a portion of the brain called the dentate gyrus. It reduces other risk factors such as cardiovascular disease, indirectly enhancing brain health. One interesting study of adults with age-related cognitive decline, age 70 to 80, actually got more cognitive benefit from aerobic exercise. They were just walking a few days a week compared to B vitamins. In another study, adults who exercised preserved their brain mass better than those who did not exercise. Other things that can benefit the brain over our lifetime, of course, are challenging the brain through brain training games, learning new languages, learning to play an instrument. There's many different ways we can continue to challenge our brain as we age. Let's look at a case study now. June approaches you about her husband's worsening memory. He's been evaluated by a doctor and they don't think he has Alzheimer's disease. She says the doctor called it mild cognitive impairment, which is another term for age-related cognitive decline. She asked, what would you recommend? Now he's in his early 60s, non-smoker, has been checked for B12 deficiency, and not on any other medications. Remember to look for other medications that may be contributing to memory problems. Since this gentleman's in his early 60s, the two things I would be most comfortable recommending for this gentleman with age-related cognitive decline would be either DHA 900 milligrams a day or Ginkgo 240 milligrams a day. Another would be to consider just a general multivitamin to make sure that he's getting a good intake of folic acid, B6, B12. You do find that as patients' dementia worsens, they tend not to eat very well, so that we may want to consider multivitamin supplements in those people. Overall, what can we say about enhancing memory with supplements? It's difficult to prove memory improvements. It depends on what you're testing for, and it depends on what population you use. It's obviously easier to prove improvements in people who already have deficits. It's important before recommending supplements to rule out fixable causes for patients with Alzheimer's disease and probably multi-infarct dementia. Several things have shown some positive benefits: acetyl L-carnitine, phosphatidylserine, ginkgo, and DHA. For age-related cognitive decline, brain-healthy lifestyle is probably the most important thing. One, to prevent it, and two, once it develops, to keep it from worsening. DHA, ginkgo, folic acid, B6, B12 may all be helpful in decreasing the memory impairment you see with age-related cognitive decline. The thing is, we don't know how long these things actually work. They haven't been studied for many years when you look at treatment. For healthy people, brain healthy lifestyle to prevent disease, the only thing that's been shown over time to help prevent disease with the supplements is DHA, at least 100 milligrams a day, over several years has been shown to reduce the risk of developing Alzheimer's disease, but remember, it's in those people who are not ApoE3 positive. Some of the other agents have some promising data, like vinpocetine, bacopa, apoquerin, but the data are not there yet to really recommend them.